Okay. All right. Good afternoon, everyone. Thank you so much for joining us for this community health worker webinar. I'm Rachel Rusnak, and I'm from the State of Connecticut's Office of Health Strategy. And I'm very pleased to host this event, which is a collaboration between our office and the Southwestern Area Health Education Center. This webinar will discuss the evolving role of community health workers, give insights into some different CHW positions, the communities they serve, and experiences of community health workers throughout the state of Connecticut. We'll also touch base on some current legislation and the current state of community health worker reimbursement here. I'd like to extend a very warm welcome to everyone to the space, and we're all very happy that you could join us. Before we begin, I'm going to address some housekeeping items. In this virtual space, we'll foster respect for all voices. We encourage active listening in a judgment-free environment. Please feel free to post any questions or comments or feelings in the chat or Q&A at any time. This webinar is being recorded, and right now all attendees are muted with cameras off. Our speakers will present for about an hour, and then we have time reserved for a robust question and answer period. Feel free to put any questions in the Q&A box or right into the chat, and we'll address them at the end of the webinar. If you're having any technical difficulties, feel free to either message myself or Alexa in the chat, or you can feel free to hop out and come back in. If you need to log in for any reason and want to return, we will be monitoring the waiting room and we'll certainly readmit you. As noted, we are recording this webinar and we'll be posting it to OHS's YouTube page, and we'll share it out to everyone who's registered. And then finally, this webinar does offer continuing education credits for certified community health workers. And this webinar will count for 1.5 hours towards your continuing education requirements. Feel free to reach out to me personally with any questions around this, or if you need any documentation. So here's what we'll cover today. We'll discuss the definition of a community health worker. We'll talk about what makes a community health worker. We'll discuss the research base for supporting community health workers. We'll have a panel discussion. We'll discuss the road to certification and the evolution of community health workers across the nation and here in Connecticut. And then we'll wrap with a Q&A. I'm very happy to introduce our great presenters today. Joining us, I have Eve Berry, President of Eve Berry and Partners Consulting and a Master CHW instructor. We have Alexa Molina, a Master's of Social Work student at the University of Connecticut and intern with the Office of Health Strategy. Cynthia Jean Mary, the Director of Training and Workforce Development at Circle of Health. And Sarita Holly, a newborn home visiting community health worker from Bridgeport Hospital. A warm welcome to all our speakers. I'm really looking forward to hearing from you today. With that, I'm going to go ahead and turn it over to Eve.
Thank you, Rachel. Well, welcome everybody, and we're going to take a bit of a journey through our world as community health workers. And I guess the thing I'd like to start with is that this role has been around formally for not all that long, but informally for a very long time. And so any of us that are doing this work join a legacy of people who've been supporting and helping people, being of service to communities for since ancient times. As we are approaching this point in history, it is clear that this is really, really an idea whose time has come, and that there's so much momentum being built around community health workers as a workforce, and particularly in the U.S. as we're navigating all the challenges that we're facing at this point in time. Next slide, please. Isn't this interesting? If you look at the projected employment growth of this occupation for CHWs, in comparison to overall occupational workforce development and growth, and also the tech sector, look at this. The projected employment growth in this occupation over the next decade is 11%, which is really quite high. All occupations during that same time period, 3.1%. And the tech workforce is 10.1%. So it's higher even than technology. I don't know if you've been listening, but all we hear about is AI and the growth of AI and technical jobs and everything. But community health workers are even higher than that. This is from the Bureau of Labor Statistics. So there are some implications for us, is that it really makes sense to invest in CHW training programs, because it's a growth industry. And it will be also important if you look at the high growth in the tech industry, it will make sense to probably increase our ability to manage the, if you will, digital literacy skills. How do you utilize technology? We certainly use it for documentation, for case notes, for client management, case management, doing research, connecting with resources. So really stepping up our tech literacy skills will be important. And so there will be so many expansion opportunities in behavioral health, rural health, and community-based care. So it's a good time to be in this profession. So I'm going to review just briefly. You all know who you are. CHW's work with so many different communities, diverse communities, people who are at risk. And we also really address health inequalities. Health equity is all about providing supports for people who have greater needs, whether it's illness, disability, higher mortality rates. And we are really part of the public health workforce. And we're focused on community health, as opposed to, even though we may work with individuals and families and help people navigate and connect to resources, it's really about overall the population health and the whole area of public health. And we're advocates and we're resourceful, as the little slide sign shows. So next slide, please. And as we're going to go over a little bit in more depth during the presentation, this profession is really gaining recognition and is being looked at and integrated into healthcare systems across the country. We are so much a bridge between people, communities, resources, to address those disparities, to improve access to care, and really focus on prevention through health education, other prevention efforts. And increasingly, and Rachel's going to talk about this a little bit later, is there's a lot of evidence that this really is a best practice. And it's been recognized by a variety of research sources, including, the Centers for Disease Control.
Eve, can we just pause for a moment? I'm
Sure.
just concerned we may be having a technical difficulty. It looks like maybe some folks aren't seeing the slides advancing. And I haven't had this issue before. Alexa, are you seeing the slides advance from your side?
Yeah, I've seen them advance.
Okay. I'm not sure. We are recording the webinar for everyone in case you missed it at the beginning. So my apologies. It looks like it's working for some folks and not others, and I'm not really sure why that would be happening. So I will say what Eve and I will be covering and what our panelists will cover are not dependent on you seeing the slides, but they will be available after. Again, my apologies. I'm not sure exactly what's going on. And sorry to interrupt you, Eve.
No worries. So what is a community health worker? I love this definition. It kind of covers everything. Community health worker is a frontline public health worker, frontline. We're on out in the community dealing with people directly, who is a trusted member. Keyword here, trust. Trusted member of and or has an unusually close understanding of the community served. This trusting relationship enables the community health worker to serve as a liaison, a link, an intermediary between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. So there's a lot going on there. We have an amazing scope of practice that we can do. A community health worker also builds individual and community capacity by increasing health knowledge, self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. So that is a tall order. I know some of you may be in roles where you are involved in some parts and not others within this definition of a CHW, but it provides such an opportunity for growth and expansion and building our skills and a variety of functions that we serve. Next slide, please. So just we have a little activity here, which is for you to tell us what your formal title is, whatever it is. And just in the chat, type in what your title is. And Alexa and Rachel are going to monitor that and share that out before we kind of compare notes on this. So here are some of the many, many titles that community health workers have. So community health workers are really, you may or may not have that actual title. But if, let's say you're a patient navigator, you're doing community health work. You're a community organizer, you're also doing community health work. So the title may not be community health worker, but you're doing community health work. What are some of the titles people are typing in here?
We're popping off in the chat here, Eve, with lots of titles. We're seeing case manager, program manager, CHW, parent ambassador, health advocate. Of course, we're seeing CHW, lifestyle coach.
Ooh.
So we know that we go by a lot of different titles, and here we're seeing the evidence in real time.
Yeah. I'm going to have to add those to this slide. Lifestyle coach. That's great. You know, there's
a shout out. I see Family Bridge in the chat.
Yeah. This is great. So there's so many titles. I know I was involved in a project, gosh, back in 2006 or so, and we were doing outreach on diabetes within the Hispanic community, and we had a group of people that we put together that they were called Promotora de Salud. So these were, that was one of the titles that I first heard about a while ago, before this really even hit broadly in Connecticut. So that was a project we called Project Dial, Diabetes Information and Action for Latinos. So many, many titles. And this is going to speak to that. And within those titles, community health workers have been defined and kind of categorized over time to really say, what is this profession? What do they do? And so this is a video we're going to share with you that is from the the core competencies that what's called the C3 project. And it's relevant because Connecticut has adopted the roles and skills or core competencies that have been set forth by this national panel group of experts working all over the country that came together and say, what is this profession? What can we call it? What are the roles and skills? And so we thought it was pretty important for you to understand a little bit more about the C3 project and its background and why it's significant for us. So let's look at this video.
Thanks, Eve. Before we hit play, I'm just going to ask if all of the presenters and panelists could go ahead and just mute so we don't get any feedback during the video. Okay, let's go ahead and move on. And Eve, I think this one's yours. And Eve, if you could just unmute.
Okay, I think I unmuted successfully after multiple tries.
You're with us. I can hear you.
Okay, can you hear me okay?
Yeah.
Okay, so I love the C3 project. It brought together people from all over the country to have incredible dialogue, reach the word consensus is right in the title. And I, excuse me, I also love the name of the report, Together Leaning Toward the Sky. That's so inspirational. And all of this started, the kind of national effort started back in 1998. So it's been a long time coming. And defining these qualities and skills is so important. Notices qualities and skills. So it's not just what we do, the skills and the roles we fulfill, but it's how we are, how we go about doing that, how we embody the qualities that make us be trusted by the communities we serve. So the other thing, one of the reasons we're doing these continuing education programs and modules is so people can keep exploring the other sets of skills and competencies that maybe you don't have a lot of experience with or a lot of knowledge of, because your particular role as a CHW only covers certain skills and certain roles. So they were talking in that video about working at the top of the scope of work, and that's really where your growth as a CHW comes. And just to link this a little bit to here in Connecticut, when the the report to the legislature came out in 2018. This came about through work done within the state through the State Innovation Model, which was a major federal grant for the state of Connecticut that looked at many things in terms of healthcare reform, but specifically one of the elements was the role of CHWs. And so in the report, which did recommend to the legislature that Connecticut pursue certification, the um, the C3 roles and skills were included in that report. And so those core competencies that were mentioned, the skills that were mentioned in that video are in fact the same competencies that Connecticut has adopted. So you can get a copy, you can look this up. I think it's on your website, isn't it, Rachel? The Office of
Yes,
Health Strategy?
yes, we do link to this, and this actually, if there are any CHW vendor training programs out there, these are the requirements that all the training programs in Connecticut for certified community health workers are required to engage in teaching on these
Right.
skills and competencies.
Right. So, and this report has a lot of really excellent background information on the pathway leading up to certification in Connecticut, and a lot of background on community health workers if you're interested for your reading pleasure. So, next slide, please. So these we heard about these roles. in the video, they're the ones that we work with, the mediation, health education, care coordination, coaching, advocating, capacity building, direct service in some cases, assessments, outreach, and then participating in evaluation and research. So those are the roles we play, and then the skills and competencies are also the ones that were defined by the C3 report, and these are great skills to have, not only in providing service to the community, but in actually navigating life and work. So these are applicable skills. I know when when I do training, one of the things that is so clear to me that these skills, I think, help you be a really good human being. So people are always saying to me, "Oh, I can use this in my life. I could use that with my family. I could use that with my friends." So, so these are really cool skills to have. I've been doing this a long time, and I still am improving my skills. So, one of the really, if you haven't run into this, I would highly recommend this. That the uh, City College of San Francisco has probably one of the most outstanding programs in the country, and they have developed a fantastic, I think it's about 1,000-page textbook called Foundations for Community Health Workers. And it is now in its third edition. And it's, even though you hear textbook, it's very, very user friendly. It's got tons of stories, it's got videos, and they produce these videos that the faculty of the program did. And this one really is a nice little introduction to community health work. So please show the clip. So one of the themes here is these personal qualities that CHWs have. And so I would like to just invite you to put in the chat a personal quality that you feel that you bring to the table as a community health worker, something that you can own, something you can say, yep, I think I'm a good listener, or whatever it is. So just take a minute and think about something for yourself that's a personal quality that you uh, think that you embody. Maybe not fully, but you are a good practitioner of that quality. So, and Rachel and Alexa, if you would just share some of those as they're coming in.
Yeah, absolutely. Here's what we've heard so far. Eve, kindness, empathy, compassion, a few empathies, understanding, honesty, open-mindedness, communication, caring, more empathy, healthy energy, listening without judgment, kindness, patience. And I'll just say, as these continue to come in, I love how that video ended on such a positive note, and how one of the speakers talked about how fun the work is. And I know it can be really challenging and trying work. But in my role at the Office of Health Strategy, I work in a lot of different areas. And I always tell this to Eve and our other community health workers that we work with. Working with CHWs for me is really fun and by far my favorite really part of my work. So I would have to definitely second that line from the video. Here we're
Yeah.
also seeing Eve, good storyteller, self-disclosure,
Yes.
empathy, confidence, understanding, and caring.
Those are great. Those are great. And, you know, so many of those things that you mentioned in the chat are the kind of things that are important. Certainly that, you know, self-awareness, you know, being healthy yourself. And so a lot of the things that were mentioned are kind of personal qualities and the advocacy role that we play. And right now, we're in the middle of a bit of an advocacy mode with trying to get Medicare reimbursement passed. And well, it's passed, but we need to get it implemented in Connecticut. So that's requiring some advocacy, which is aligned with really that commitment to social justice. So one of my favorite things, favorite saying comes from Gandhi, which is, you know, we're living in such tough times right now. That things, the kind of strife and the divisiveness and the struggles that people are going through in the current environment. And so, I love what Gandhi said, which is be the change that you want to see in the world. So I know there are a lot of times when I feel like there are a lot of things I can't control. I would like to, I can't, but all I can do is kind of try to change myself, to be that change and to exemplify that. So that's my guidance to you, is start with yourselves and cultivate these qualities, cultivate your skills, um, stretch yourself in your role within what is prescribed by the scope of your particular job, but it's always about growing. So, um, so these are some personal qualities to embody and to aspire to. So next slide.
Thanks, Eve. Um, so I'm going to take the reins for a few moments, and I want to talk with you a little bit about the impact of community health workers. I know, in our day-to-day work, we all have sort of anecdotal evidence of how important community health workers to our communities and our neighborhoods and the state and at the national level, right? But there's also a significant amount of scientific evidence that tells the story of community health workers. We have over 30 years of scientific research in peer-reviewed studies and journal articles, right? And this is a large cadre of evidence that supports the effectiveness and efficiency of community health workers. Here at OHS, we're also working on a resource compendium that will link to all of these studies, and we'll share that out once it's finished. But I want to bring this up in the context of the kind of world that we're living in today. It's important for community health workers and advocates and employers to have access to this more hard evidence about the significant work that community health workers do as we're moving towards reimbursement for community health workers, and as things have become more professionalized. It really enhances advocacy when we can bring that data that shows these impacts, as well as the personal stories that we bring from the community. So here we've just listed on the slide, I'm not going to read these to you, but sort of some of these strong evidence ties, and I'm going to go into those a little bit more here. So a few areas where studies have really clearly defined the significant positive impact of community health workers through documented improved health outcomes. So you can see this is in a wide variety of areas that having community health workers has made these really positive impacts. And many studies have shown that having community health workers embedded in either a medical practice or in a clinical team makes the whole team more effective. And we know this, but I'll say it anyway. That's because community health workers are connecting with patients and providing the resources and care that other providers miss, or they don't know how to provide, or for whatever reason, they can't provide, or they can't make that connection with the patient. Consistently, community health worker intervention shows improvements, especially in patients with diabetes, high blood pressure. We see that CHW intervention leads to better medication adherence and better self-management of chronic conditions. So it's important for community health workers, employers, and advocates, all of us that are really working towards pursuing the promotion of the CHW profession, but also reimbursement, both through Medicaid and private insurance, to keep in mind really this like hard evidence base as well, and to be able to cite these often, when we're out there talking and advocating. So here's one of my favorite areas of impact. This is kind of my baby. I work on the Family Bridge pilot in the greater Bridgeport and Eastern Connecticut regions of the state. And here we see daily the positive impacts of community health workers on maternal and infant health as we're collecting and analyzing data. So we see it right in the community, but I'm really looking forward to Connecticut being able to publish our data on the specific results here in Connecticut. But the evidence does already exist. And here's what other states have seen and other communities where they've implemented CHW interventions or CHWs into the community, into the clinical teams. They see increased rates for moms that participate in prenatal visits and in their postnatal follow-ups. We see better rates of breastfeeding and higher immunization rates for infants. We see more birth preparedness among parents and reduced infant mortality rates, which is really huge, and that goes up to age 5. Here are some general CHW health impacts in a more inpatient or hospital-based setting. They are taking the time to work really carefully with patients. They address needs holistically. And what do they result in? They result in decreased hospital admissions, reduced numbers of emergency department visits, reduced hospital days spent overall, which is huge in terms of this is like a big measure that insurance looks at. So to be able to reduce those days spent in the hospital is a really significant outcome. CHWs also lead to higher engagement with primary care providers and moving into that more preventative care space and away from acute or emergency or urgent care. So what does all this tell us, right? There's definitely a return on investment. Studies commonly cite that there's like a 2-to-1 to a 4-to-1 return on investment. So for every dollar that's spent on community health worker interventions, we can see $2 to $4 in return. I would broach that that could be even higher, right? Because we see a very wide range of those ROI and cost savings studies in the literature and in the research. And this results not only in lower costs for the healthcare system, but for our communities and for the patients themselves when they're spending less on this urgent or emergent care, and they're able to put that back into their communities or into their families. Um, Really, there's also a huge impact with better management of chronic conditions that lowers overall costs. So when people are able to have that care that's helping them manage their chronic diseases, whether it's management or nutrition counseling or better medication adherence, all of this contributes to a really big impact on our costs in the healthcare system at large. Um, so this is just to kind of like close out this little section on the impact. People that are doing this community health work, regardless of the setting, is often not labeled as they're often not labeled as a community health worker. When we asked you all to put your titles into the chat, we saw a wide variety of titles. Some of them were CHWs, some of them were dual titles, and some of them weren't even close. So we just wanted to share this picture because CHWs are represented all throughout our communities. They come from everywhere. They're in our neighborhoods, and that's why they're so effective. And often this kind of work starts out as volunteerism. And I just like to always say, whenever I'm speaking about community health workers, because I heard this when I first started working in the industry, that often folks will say that they were born to be a community health worker. And I think as we meet our panelists coming up next, we're going to see that as well. So with that, I will go ahead and hand this off to Alexa.
All right, everyone, we will start the panelist portion that we have here for you all today. Just to reintroduce myself, I am Alexa, and I'm currently an MSW interning at OHS because I have a policy concentration. So I'm very interested in all the work that is being done in terms of CHWs and the impact in Connecticut. And I would love to introduce Curator Holly Hicks. She is a CHW and doula at our Family Bridge program at Bridgeport Hospital. And she's also associated with United Way and Doulas for Connecticut. And so I really just want to hand it over to Sarita and ask you, like, can you tell us a bit about your role? What inspired you to become a community health worker and what primary community you serve?
Hi, yes. My name is Sharita Holly Hicks. I work as a community health worker with the Family Bridge program here in Bridgeport. As a Family Bridge community health worker, I support families that's going through the postpartum stage, early childhood, and any other life challenges. I was inspired to enter this field of work growing up in the inner city and becoming a teen mom myself. I kind of knew firsthand how hard it was to navigate through certain systems like DSS or WIC or those services. But then later in life and my career, I started to notice how little support women received, especially after giving birth, especially in my community. So with those experiences, it kind of made me want to become someone to bridge the gap between families and have them feel supported and informed and empowered. So primarily we serve families in Bridgeport and other surrounding communities, new parents and their families, parents that have given birth that might be new to the country and are having trouble navigating through unfamiliar systems. Some families, they face challenges like housing instability, limited access, healthcare, financial instability, transportation. But, no matter what the situation is, the goal is to make every family feel supported and respected.
Yeah, thank you for sharing that, Sarita. I really love the personal impact that you tied into, like what drew your interest in becoming a CHW. And with that, I know you already shared about what population you serve and how they come to you, but what would you say a typical day looks like for you as a CHW at Bridgeport Hospital?
A typical day for me, it kind of varies. I might be doing a home visit, or I might be helping families get connected to community programs, like WIC or SNAP. And I also St. Vincent's Medical Center, and I do rounding on the postpartum floor on certain rural mothers who have just given birth into our program. So every day kind of looks different.
Yeah, I can certainly imagine that.
Mhm.
And I know we personally spoke before, but you told me that you had just started your CHW journey. So I was hoping to ask you what formats or any sort of delivery methods in terms of like continuing education, like what we're doing today, you have found
Yeah.
to be most helpful for you.
Like the virtual trainings, in person, like workshops, commun panels like this discussing like different community resources and community fears as well.
Yeah, no, especially the virtual. I feel like it's very accessible at these
Right.
times. And so with that, are there any like critical, like emerging topics or just simple skills that you feel a CHW should prioritize right now in terms of continuing education?
I would say for me, maternal mental health is very critical right now. The housing resources, just crisis intervention and cultural competency and birth work, I would say. Did that answer your question? I'm sorry.
Yeah, it did. You cut off a little bit
Okay.
at the end, but I think we got the gist of
Oh,
what's important for your relative field. And I'm sure there's different applicabilities for people in different areas as well.
yeah.
And just getting into sort of your support systems and networks, what has been sort of more most valuable for you in this role?
I think it's the support from other CHWs, maybe the community partnerships that we collab with, like hospitals, clinics, early childhood programs. I think it helps make sure the families like don't fall through the cracks.
Yeah, I think having a support is just really tremendous. And being able to give that support to others, like you were saying, like not having them fall through those cracks. And I
Mm,
know, I think Rachel said this earlier, but times have been changing constantly right now with the new administration. So
yes.
I have to ask you, have you noticed any new or increasing challenges compared to last year in your field?
Oh, yes, yes. This year I noticed an increase in like I said, the housing instability and mental health needs, I think, are very challenging right now. The new challenges with the new administration, like you said, many of our patients are experiencing multiple challenges and kind of require a little more support and attention. So they're going through a lot of different stresses right now.
Yeah, thank you for sharing that. And just to finalize with the set of questions that I had prepared for you, I wanted to have your take on what you personally wish people understood about the role of a CHW. Like, what is your take on that?
I would say I wish people understood what the CHW role was about. Like, I feel like some people think that we're just resource providers and we're more advocates, educators, connectors, just trusted community members. So I think that'll be good if they just knew that.
Yeah, like I agree with you, especially with the different terms that are used for your all's roles. So definitely having just a clear understanding of what community health worker is and does would be beneficial
Right.
in all totality. But those were all, like I said earlier, the listed questions I had for Sarita, and she did a wonderful job sharing her experience with Family Bridge and her field in maternal health care. So I did want to bring it back to you, Rachel, and open it up for a Q&A since we have quite a bit of time left to see if there are any other questions we want to ask Sarita specifically, or just any other inquiries that attendees may have.
Thank you both. That was wonderful. And I really enjoyed listening, to what your day looks like, Sarita. And I did jot down some notes so that we can think about some resources, especially around the maternal mental health topic. But I think just sitting here, so considering your closing, that you wish more people understood, really like I think it's the complex role of what a community health worker does, and you did a really nice job sort of summarizing really what your work looks like. I wondered if you or Alexa, so I'll put one of you on the spot, do you guys have any suggestions about how we can get that messaging out there and make it more clear for really for everyone that works with CHWs or may run into them, like how can we promote really what CHWs do?
I
And
don't
I'll
want
throw
to
it to
talk
Eve
over you.
too. I'll throw it to
Okay.
Eve too. Eve, how can we
I'll
get the
start.
word out there?
Sorry.
No, that's okay. Oh no, Alexa, or if you have something, too. I just didn't want
Yeah.
to put you guys on the spot.
I was going to start with the academic perspective just because I am a student right now. So I do feel like CHWs are well known in literature, but I don't think what I'm seeing during my internship right now is that it's not really translating with the public as well. So I think sort of addressing that gap through any sort of communication hub would be beneficial. That was just my little initial thoughts on that question.
Thanks, Alexa.
Yeah, I'll jump in on this. When you asked that, it was, I was struck by that as well, and it's so true, is what's a community health worker? And it made me think, how cool would it be to do kind of like a campaign, like do public service announcements, just kind of, what is a CHW? Meet a CHW, just kind of get it out there, because look how much social media is influencing people. People don't even read anymore, it seems, but people watch. So I would just think it would be great to do a little um, campaign to raise awareness and um, repetition, repetition, repetition. It's like marketing 101. So let's market CHWs so people pique the curiosity about it. So that's my 2 cents.
All right, I love this. I think we're on the same page because I also wrote down public awareness campaign. So, all right, well, meet a CHW. I love this. We have a social media genius at OHS. Let me just throw this out there. If you would be interested in being featured in a public awareness campaign or doing like a little PSA about I'm a CHW, here's what I do, or the meet a CHW concept, just throw a note in the chat and Alexa and I will reach out to you. And even if you think you might be interested, throw it in there. No pressure. We won't force you to do it if you don't want to. But if you might be interested, go ahead and put your name in the chat or a little note. And I saw some folks in here that I recognize. David, you are already on a panel, so no harm in you doing a PSA too.
And I have another thing to add into that we could do. What about launching a Connecticut CHW YouTube channel and having, one thing is a little clip for a public service announcement, but we could do some very interesting podcasts.
Yeah. All right.
So kind of expand this interview panel idea and get people to be on our channel. So
I love it.
and
Yeah. If you
anyway,
would, yeah, if you're interested in any of these concepts or if you have something else to add to this conversation, please go ahead. Either feel free to put your ideas in the chat, or if you're thinking about it and you come up with it later, don't hesitate to reach out to us and let us know so we can keep the good times rolling here. All right, let me see if I can bring up the presentation again. All right. Okay, now I did sort of take over. That was only one question, but did anybody else have any other questions for Sarita or Alexa or Eve before we move on? And you can go ahead and type them in the chat and I can read them out. All right, I'm not seeing any right now, but we'll have a chance at the end as well for some Q&A. So with that, I'm going to go ahead and throw it back over to Eve.
You've heard a lot about the role of CHWs. I mentioned early on that this has been around a long time. I'm sure it goes back to even before the 1600s, which is the first history on this slide we have. And it was in Russia where people were going out doing community health work. And China had a whole program for many years where they trained 1 million people to be what they call barefoot doctors. And it spread to Latin America and then to Africa. And it wasn't really until the 1960s that it hit the US. So that's less than 100 years ago. So, and that came about with the Great Society programs. The community action agencies. I'm doing a training right now, a community health worker core competency training at TBCCA in Eastern Connecticut. And, you know, it came out, it was one of the community action agencies in the very beginning. And we're seeing now, with all the funding cuts, because at least in Connecticut, we haven't implemented Medicaid reimbursement, but 80s and 90s funding was, the programs kind of faltered. And really in the last 20 years, we've seen that evidence base really build that has resulted in the research and the interest and the curiosity and the integration of CHWs into care teams. So this is a long road we've been down and we've got more to go. Next slide, please. In the US, things really did start to pick up. This was covered in that video of the National Community Health Advisor Study, where they started paying attention. They said, there's something going on here with this. Let's take a look at it. But they didn't even start collecting data about this until 2010. Between 1998 and 2010, they did do this workforce study saying there's something happening. We think this is an emerging profession. And also in 2010, along with this collecting of data on CHWs, was Obamacare was passed, the Affordable Care Act. And it was the first time when any kind of legislation was passed that CHWs were explicitly mentioned. Centers for Medicare and Medicaid Services started getting very active with it. And by 2016, 16 states had passed certification. And this is where Connecticut starts to pick up with, even though there was a lot of activity leading up to this, even starting around 2012 or so, the law got passed to say, let's look at that feasibility. And that resulted in that report that we looked at earlier, at least the cover for it, that passed the core competencies for the C3 project in Connecticut. By 2018, again, not so long ago, they really started looking at the economic impact. Certification was passed in Connecticut in 2019, and it started to be implemented and 2020. So we're 5 years into certification. Rachel, do you know how many CHWs are certified right now? I think it's over 500.
Yeah, I was going to say, I don't have the exact number, but we're around 500 certified. So
Something
in
like that.
5 years, 500 certified CHWs. A lot of those folks are on their second round. They've been renewed once already. So I think this is a good trajectory. And, we don't really have a count of our CHWs in the state that are not formally certified. So we know our workforce is really much larger than that.
Yep. And next slide just will recap the more specific journey of the milestones leading up to the certification happening. And I mentioned that SIM grant, the state innovation model, really took a deep dive into promoting CHWs and primary care teams. The advisory committee in March of 2016. This advisory committee was formed to develop policies to promote the workforce. The Public Act 2017 established the CHW definition and scope of work. That report came out that we looked at, and then certification moved along. And so those were some of the actual pieces of legislation that became law, and it put us where, well, like I said, we're 5 years in now, but it's been a steady journey, and we have more to go. We have more to go on this path. So.
All right, thanks,
And
Evie.
I'm going to turn it back to Rachel for this part.
All right, we're getting there. I know it's late in the afternoon on the Monday, right back from Thanksgiving. So I really appreciate your attention. I'm just going to take a couple more minutes and then we'll launch into our Q&A if there is anything else. I just want to talk about more recent activities around the formalization of the community health worker workforce and some of the benefits of that, but also, some of the drawbacks that either we've observed here in Connecticut or that we've heard or, kind of been popping up in the literature around community health workers. So, some of the benefits are really apparent and they're wonderful for the workforce, right? There's more credibility. The roles can be a bit more standard. I mean, I know from the titles and what we're hearing from the community, that's a work in progress for sure. But certainly standardization around the core competencies for community health workers is a good thing, because we know that the folks that are out there serving the community have, this really strong knowledge base. One of the best things, though, is that there are more professional development opportunities for community health workers, and career ladders are being built as that workforce grows, which is great for all of you here that are community health workers, right? Because we have more of an opportunity to expand our roles and reach. And then finally, reimbursement is really great, because right now a lot of this work is based on grants, right? So we rely on philanthropy, or we rely on sort of short-term federal or like state infusions of money, which make it really hard to to engage in any kind of continuity of care or continuity of our projects. But then, there are some drawbacks, right, also of the formalization of community health workers as a workforce. And I don't want to not really give that its due, because this is something that is impacting us on a daily basis, right? So some of the differences in certifying entities. So Connecticut has certification, Texas has certification, right? Lots of other states offer certification for community health workers, but they're all a little bit different, even if they do use the C3 core competencies. So that's a little bit of a challenge, right? How transferable is your training and your certification if you were to move? Or, if someone came to Connecticut, how do we know that they've got like the same level of training as the CHWs that have been trained here? Also, there are some barriers to certification, right? Taking a class can be prohibitive because of the cost. And there are some scholarship programs, but obviously, like, not enough for everyone that wants to be formally trained as a community health worker. And there's a cost to getting certified, right? There's a fee, and that fee has to be paid every 3 years. And then, in addition to the fee, there's the continuing education requirement. Um, so really what I'm saying with this slide, and why I'm sharing some of these barriers sort of that we've heard about, or some of the drawbacks, is that this is something where, as a community within the state, we can work certainly to try to see how we can overcome some of these obstacles or barriers and reduce them. So one of sort of the challenges that we had heard at the state level was that there's not enough continuing education, or it's expensive. So we are trying to offer some more of these continuing education opportunities that are free of charge so that more folks can engage, and just to create sort of that sense of community too, so that there's a spot, at least right now with the Office of Health Strategy, where people can come, to get some of this information, to access some of the research that we've been working on, and for continuing education opportunities. We've also heard that there can be sort of like an us versus them, right? I'm certified, you're not certified, and vice versa. And that can be challenging in a community of folks that really do work very closely together. Um, and then finally, it is really hard to formalize sometimes CHW components and how are we going to reimburse, because there's a really unique component to this work. We heard from Sarita sort of like all of the different activities that she engages in with her families on a daily basis. And it's hard to get people to understand everything that she's working on, right? And I think we all face this. How do you quantify or bill for like hours that you may spend counseling a family and helping them to like apply, for services? It's really hard to identify that by a billing code and submit. So while there are a lot of benefits to the formalization of the workforce, I just want to note that we are aware of what some of the challenges are to that, and we are thinking about that at the state level. The Community Health Worker Advisory Body meets, I got to put a plug in, we meet quarterly on the first Thursday of the month, and we talk about these kinds of challenges. This is an open meeting, so anyone is invited. You can find the info on our site. We're actually meeting this Thursday, December 4th at 10 o'clock. And these are the kind of topics that we talk about there. So if you have 2 cents or more that you want to put in or share, you obviously can contact myself or Alexa. You can put it in the chat, or you can come to the meeting. And before I leave this slide, I just want to note one more sort of like challenge to the profession that's not necessarily associated with the formalization, but could be. So in the news, you may have heard in the recent weeks, changes from the federal government around the Department of Education's designation of professionals. And I want to raise this because there's potential that it could impact community health workers. Many CHWs actually are MSWs or may have another degree, which is now going to be impacted by borrowing ability, or some CHWs go on to become an MSW or perhaps an RN. So this impacts the providers that CHWs work with right now, like RNs, APRNs, MSWs, physical therapists, occupational therapists. And depending on how Connecticut does move forward with billing, could have an impact on the kind of providers that CHWs work with or are billing under, if that's the approach that Connecticut takes. It's a little unclear what that approach is specifically going to be yet. But I just wanted to note this because what this legislation is doing is changing the designation of certain professions from being professional to non-professional, which does have the capacity to impact the work that community health workers are doing and your colleagues. And I just felt like because it's in the news, I wanted to make sure that everyone was aware of this change and the fact that it may end up impacting your work, especially in terms of student loans, which I am familiar with. So I wanted to go ahead and share that with everybody. And Eve, I don't know if you had anything that you wanted to add around this change in policy at the Department of Education.
No, I am not that familiar with it, being long past student loan days. But I'm really curious about keeping up with it and any developments. I think it's pretty significant and important tracking.
Yeah, absolutely. And as this kind of guidance evolves and we get more information too, we will definitely link to it from our website. And then finally, the last thing that I wanted to mention before we move on is around Medicaid reimbursement, because I know this is a really hot topic. And there was a CHW summit a few weeks ago, right, that really was focused around this. So, and you heard Eve say that the legislature passed a bill here in the state in 2023 that directed the Department of Social Services to design and implement Medicaid reimbursement for CHWs. So that is in progress and that's outside of my purview. So I don't have a ton of information that I can give you, but I did want to share, and what we have here listed on the slide are some of the potential services for what could be covered based on the language in the bill and based on what 24 other states already cover through their Medicaid reimbursement mechanisms. So, it's things like the coordination of medical care, system navigation, prenatal. I see prenatal support. I don't see postnatal support, which is something I would like to see. Health promotion, coaching for self-management. So I would say that this is another area. If you have something to say about this, there's an opportunity now as this is being developed, to get involved and to self-advocate for the work of community health workers, right? And what we should think about for this. And I did see that Alexa, thank you so much, put the link in our chat for the next Community Health Worker Advisory Body meeting, which is happening later this week. So with that, I will wrap it up. I did want to open up if there's any Q&A at all for any of the speakers today, or just things that you would like us to consider. Please go ahead and use either the chat or the Q&A feature. And this is not like a one and done. We will be restarting with more of these sessions after the first of the year. We have some great topics lined up and some speakers that are really eager to present to our CHW community, but we wanted to give everybody a break for the holidays. So we will reconvene next month. If you have a question or something comes to you tonight while you're making dinner, you can always reach out via email to myself and Alexa, literally for anything. We're super responsive with community health worker topics. And we'd love to hear from you all. Eve, Sarita, or Alexa, did you have any closing remarks or anything that you wanted to share before we log off?
I would just invite people to not just ask a question, but if you have a comment, to please share that with us as well. Any comments, points of view, requests, recommendations, and questions.
Thank you. Yeah, and I heard Sarita give us a few topics that she would like continuing education on. So if anyone here on the call, we will send out a survey as well after this. But if you have any ideas right now, feel free to throw those in the chat as well. I'm not seeing any questions now. So thank you all so much for hanging with us late this Monday afternoon. If we don't see you, we hope you have wonderful holidays and we'll see you next year.
Thanks for showing up.
Yeah, thanks everyone for coming.
Thank you, everyone.